A concussion is a traumatic brain injury caused by a bump, a blow, or a jolt to either your head or your body that causes your brain to move rapidly inside the skull. Symptoms of concussion differ for each person and with each injury. Symptoms may not be noticeable right away and may develop in the hours or days following an injury, or even when the demands of regular life are resumed. Signs and symptoms of a concussion include headaches, nausea, dizziness, fatigue, fogginess, amnesia, confusion, difficulty concentrating, sleep disturbances, either sleeping too much or too little, balance issues, sensitivity to light and sound, mood changes. Some people become more anxious or irritable or just low. In roughly 10% of concussions, there is loss of consciousness. Concussions are typically associated with normal neuroimaging studies. In other words, you can't actually see a concussion on an MRI or CT scan because it is a metabolic injury. The reason patients are referred for a scan is to rule out a skull fracture or an intracranial hemorrhage, more commonly known as a brain bleed. Anyone can have a concussion without losing consciousness. In fact, in up to 90% of cases, there is no loss of consciousness. In the first few days after the injury, you should watch your child very carefully. You should get immediate medical help if your child loses consciousness, is extremely sleepy or drowsy and can't be awakened, vomits repeatedly, gets a headache that worsens, lasts for a long time or is severe, has weakness, numbness, trouble walking or decreased coordination, has difficulty recognizing familiar people, is very confused, has trouble talking or slurred speech, and has a seizure where their arms or legs shake uncontrollably. Most likely your child will be absolutely fine. The vast majority of children who have sustained a concussion make a complete recovery with no complications. However, it's crucial that a child with a concussion is diagnosed and treated properly, and that he or she avoids physical and mental exertion for the period of time recommended by their doctor. Some children with concussions do develop more serious complications. However, this is mostly true of children or adolescents who suffer a second concussion before fully recovering from their first. Concussion is a metabolic injury, and as such, is invisible on a scan. We take an athlete's history, conduct a physical examination, perform a standardized balance assessment, and use computerized neuropsychological testing. We can only then make a diagnosis of concussion based on the results of all these tests. It's not a singular test or just a history. No, sleep is the best treatment for your concussion. It is okay to let your child sleep without interruption the night of the injury, but only after evaluation by a specialist or physician. For the first 48 hours, we encourage strict rest. That means no TV, no iPad, no cell phone, no Xbox, no computer, just simple bed rest. After 48 hours, under guidance from a physician or vestibular physiotherapist, we encourage gentle activity like swimming, walking, or even cycling on a stationary bike for 20 minutes a day, but at a very specific heart rate. Scrum caps were designed to guard against severe brain injuries such as a skull fracture. Gum guards protect you from orofacial injuries. We still strongly encourage you to wear protective gear, but it doesn't actually prevent concussion. It is possible to sustain a concussion without a direct hit to your head. Remember, your brain floats in fluid, so you can imagine with a whiplash, Your body is oftentimes stationary, but your head snaps forward or backward, shaking the brain around inside the skull, causing brain injury. After a concussion, we prescribe a period of mental rest, avoiding all activities that requires your brain to work hard. This could be critical thinking or problem-solving activities such as mathematics at school. You may find that after your 48 hours of rest, you feel normal, but then when you go back to work or school, your symptoms reappear or get worse when you are doing something that requires a lot of concentration. Your concussion team of medical specialists, such as a sports physician, physiotherapist, neuropsychologist, or neurooptometrist, will all work together to make the best decision for you to return to school or work at an optimal pace that allows you to get back into society as soon as possible without aggravating your symptoms. If an athlete is suspected of having a concussion, he or she must immediately be removed from play, be it a game or practice. Continuing to participate in physical activity after a concussion can lead to worsening concussion symptoms, increasing risk for further injury and even death. Parents and coaches are not expected to be able to diagnose a concussion. That is the job of a medical professional. However, you must be aware of the signs and symptoms of a concussion, and if you or a coach is suspicious, then the child must stop playing. As we say, when in doubt, sit them out.